Start, Abdul?
I have.
Yeah. Okay. مساء الخير and good evening for everyone. النهارده معانا مجموعة من 5 أطباء. كان المفروض هيكونوا 6 لكن الدكتور أحمد علوان في المعمعة حاليا موجود في العناية المركزة لغاية الساعة 8 فمش هيقدر يكون معانا. لكن معانا دكتورة ندى حسن وندى is a general practitioner طبيب أسرة في ساوث ميلبورن. معانا الدكتورة سمر أوجيمي infectious disease at Monash infectious disease specialist at Monash. معانا الدكتور مراد إبراهيم respiratory physician تخصص صدرية. ومعانا الدكتور جون روفائيل تخصص أوعية دموية. مجموعة كويسة وأتمنى اللقاء يكون مفيد لكل اللي هيسمعه. هنحاول نخلي أغلب المعلومات متوفرة بالعربي علشان خاطر دول الناس اللي احنا عايزين نوصل ليهم المعلومات النهاردة. برضو هنغطي الإنجليزي الإنجليش بارت of it. كان هنبتدي بالدكتورة سمر أوجيمي علشان تدينا فكرة على الوضع الحالي as she sees it.
Thank you, and I apologize. I'm mostly going to be talking in English and with some translation. But essentially, so I'm an infectious diseases physician and immunologist. And as a result of that, we are very, very much involved in the care of patients that come in with COVID. And what COVID has shown itself to be is that it's very much really an immunological condition, because it's a virus that drives the immune system and causes a lot of inflammation in the body, not just in the lungs, but across the body. And as a result, that causes a lot of lots of different organs to shut down, including the lungs, and poor oxygen going around to the rest of the body, but as well as causes kidney issues, can cause strokes and blood clots. And so as a result of that is where my role comes into it, and that's looking at all the treatment and essentially what we do in terms of managing COVID patients, and that's to try and help calm the immune system. And I'm sure we'll be going into some of the treatments a little bit later with some of, I'm sure you all have lots of questions around that. But essentially, for us to try and help patients with COVID, we try and calm the immune system down that drives the really, really bad COVID that lands people in hospital. And what we are seeing really at the moment is that people who are ending up in hospital are predominantly unvaccinated or single-dosed vaccinated people. But the majority have not received any doses, and they're the ones that are ending up in hospital. What we're also seeing is that there are some risk factors. So people might have underlying conditions that predispose them to bad COVID. And they could be, they go along the lines of being male, so being a man, being obese, having blood pressure issues, heart issues, asthma, some of the common risk factors. The other thing we are seeing, and unfortunately, these are people who may not respond very well to vaccine, but we're also seeing that people who are immune compromised, which means that their immune system is weakened, whether it be by medication or whether it be by having underlying immune issues and immune deficiencies, they're ending up in hospital. And really the the number of, the very small amount, about 2% of people who are double vaccinated ending up in the intensive care and are people who have weakened immune system of the very, very elderly. So what we are seeing now, what I see in my day-to-day life is that vaccinations are making a huge difference. And hopefully we can address some of your questions relating to the vaccine, because I really do see the importance of them and the difference that they are making.
علشان خاطر بس نلخص الدكتورة سمر قالته. الدكتورة سمر اتكلمت على الوضع الحالي اللي هو is not really very good. المستشفى فيها ناس كتيرة حاليا عندهم كوفيد، عندهم كورونا، و كتير منهم بيحتاجوا عناية مركزة نتيجة الجلطات الدم اللي هي معروف انها بتحصل في إصابة الكورونا. هنخلي الباقي في خلال الأسئلة اللي جاية. دكتور مراد.
Thank you, Dr. Ramzy. I'm going to share my screen. Sorry. You need to enable screen sharing.
حضرتك يا دكتور مجدي، لو حضرتك الهوست لازم enable screen sharing. لو تعلم.
لا، الهوست عبدو
مش سامعينك.
مش سامعاني؟
لا سامعين حضرتك، احنا ما سمعناش دكتور عبدو، كان على ميوت.
I have now.
Oh, there it is.
Yeah.
Still not allowing me. I think it's allowed you. هي عملت لك انت بس.
Oh.
You might have to go to Murad's. There are the 3 dots there, and you have to make him host.
You have to allow Murad to be the host, as Samar suggested.
Yeah, all right. The 3 dots more doesn't tell me anything.
If you bring up the participants list.
Yep.
On the side,
yeah,
and then if you go to his name and click on it, you should give you the option of being able to make him host.
Here, make a host. Thank you. Should be all right now, Dr. Murad.
Thank you. مساء الخير، أنا اسمي مراد إبراهيم، أنا respiratory physician، أخصائي أمراض صدرية وأمراض باطنية، وأنا بشتغل في البابليك وفي البرايفت سيستم as well. حضراتكم عارفين طبعاً الكوفيد 19 pandemic is real. في حوالي 240 مليون حالة في العالم، وتقريباً حوالي 5 مليون وفاة من الكوفيد 19. في حوالي 6.5 بليون شخص في العالم خدوا فاكسينيشن من للكوفيد 19. السيتويشن في استراليا الحمد لله احسن بكتير من مناطق تانية في العالم. احنا سو فار لحد 18 اكتوبر كان عندنا 145,000 حالة، منهم للأسف 1,500 حالة وفاة، وحاليا في 27,000 اكتف حالة في استراليا. different states طبعا different numbers. فالنهارده التوك بتاعتي هتتكلم مور على ايه اللي بيحصل في المستشفيات في فيكتوريا. احنا عندنا حوالي 780 حالة في الهوسبيتال، منهم 150 حالة في العناية المركزة، ده غير آلافات الناس التانيين بيبقوا managed through اللي احنا بنسميهم community pathway او هوسبيتال ان هوم، يعني الهوسبيتال نفسها المستشفى هي برضو مسؤوله عن الناس دول من خلال الكوميونتي او بيعالجوهم في البيت. طيب مين اللي بيخش الهوسبيتال؟ مين اللي بيخش المستشفى؟ احنا شايفين ان mainly الناس اللي هم مش واخدين الفاكسينيشن، و a lot of them للاسف من الكوميونتي بتاعنا من الميدل ايست عرضه اكثر ان هم يخشوا المستشفى، حوالي 30 مره عرضه اكثر ان هم يخشوا المستشفى. وبرضه هم نفس الناس دول اللي مش فاكسينيتد او اللي خدوا 1 دوز اوف فاكسين هم اللي بيحتاجوا يخشوا العنايه المركزه. للاسف برضه حالات الوفاه اكثر في الناس اللي هم مش فاكسينيتد. انا حاطط بيكتشر هنا بس عشان ادي لكم فكره عن اللي بيحصل للناس اللي بيجي لها انفكشن شديد يعني من الكوفيد. اللي على الناحيه الشمال ده نورمال سكان للرئتين، زي ما حضراتكم شايفين البلاك ده اللي على الناحيتين هي دي النورمال لانج، الجهاز التنفس يكون سليم لما يكون بلاك. الحته اللي في النص دي ده اللي هو القلب، والحته الوايت دي البيضه دي ده اللي هي الاوعيه الدمويه، دي لازم تبقى موجوده. على الناحيه اليمين حضراتكم شايفين يعني مثلا لو بصينا على السي تي سكان ده، وده شخص عنده كوفيد 19 there is hardly any black، ما فيش بلاك، اللنج كلها ملتهبه، الشخص مش قادر يتنفس، وعشان كده بيحتاجوا يحطوه على فنتيليتور في العنايه المركزه. ايه تاني اللي حاصل في الهوسبيتال؟ رياليستيكلي يعني اللي بيحصل ان احنا بنعمل ميتنج افتر ميتنج افتر ميتنج عشان نحاول نمانج البانديميك اللي حاصل. بنضطر نجيب دكاتره من سبيشالتيز مختلفه، يعني هم مش بتوع يمكن ميديكال او اخصائي مثلا infectious disease او respiratory عشان يشتغلوا في الكوفيد وورد. طلبنا من بعض الكونسلتنتس ان هم يعملوا الشغل بتاع الدكاتره الصغيرين اللي لسه في التريننج. بنجيب nurses from other wards from surgical wards يشتغلوا في الكوفيد وورد لان مش لاقيين عدد كفايه. بعض الستاف بيبقوا فيرلود، يعني بيضطروا ياخدوا طبعا ايام اوف ساعات لانه لو جالهم اكسبوجر اند سو اون، ده بيحطوا بريشر علينا. الامرجنسي ديبارتمنتس اضطروا يعملوا خيم بره عشان يستقبلوا حالات الكوفيد 19. طبعا سيتويشن يعني صعب للكل، واكيد حضراتكم سمعتوا انه ان احنا اضطرينا نكنسل الالكتيف سيرجري، يعني لو اي واحد عايز يعمل هيب ريبليسمنت ولا عايز يعمل يعني عمليه للفتاء مثلا لازم يستنى، لو مش قادرين ندخلهم الهوسبيتال. طب بالنسبه للناس اللي بياخدوا فاكسينيشن، هل بنشوف الناس دول في الهوسبيتال؟ لا، ما بنشوفهمش في المستشفى. معظم الناس اللي بيجي لهم بعض السايد افكتس، اعراض الجانبيه بسيطه من الفاكسينيشن بتقعد يوم يومين وبتروح معظم الناس. طبعا حضراتكم سمعتوا عن الكلوتس او الجلطات اللي ممكن تحصل مع الأسترازينيكا. الانسيدنس بتاعها حوالي 10 في المليون. الفايزر كمان موضوع الالتهاب اللي بيحصل حوالين القلب او في عضله القلب برضه حوالي 12 في المليون، يعني نسبه ضعيفه جدا، وما بنشوفش ناس بتخش الهوسبيتال بالحكايه دي. ده تيبل بسيط عشان بس نعمل كومباريسون ما بين الكومبليكيشنز اللي بتحصل من الاعراض الجانبيه اللي بتحصل من الكوفيد 19 ومن الفاكسينيشن. الريت اوف ديث يعني الوفاه تقريبا حوالي 2% من الكوفيد 19. بالنسبه للأسترازينيكا هي 6 في 9 مليون، يعني 1 في 100,000. وفي الفايزر الكلام ده في استراليا ما شفناش حالات وفاه as far as I know يعني من الفايزر او الموديرنا فاكسين. الريت اوف سيريس كومبليكيشن اعراض جانبيه شديده 20% تقريبا بيضطروا يخشوا الهوسبيتال بالكوفيد، 14% منهم بيكون حالتهم شديده. while بالنسبه للأسترازينيكا يعني 10 في المليون بيجي لهم موضوع البلاد كلوت، و12 في المليون بالنسبه للفايزر بيجي لهم الالتهاب اللي حوالين القلب. اللي انا عايز اقوله في الاخر انه كوفيد 19 is a serious disease. ده مرض شديد. الهيلث سيستم بتاعنا، المستشفيات بتاعتنا overwhelmed، بيجي لهم ناس كتيره جدا. احنا بالعافيه بنحاول نكوب ماشيين مع الانفكشن. الهوسبيتالز المستشفيات بتتملي بالكوفيد 19 بيشنتس، ما بتتمليش بعيانين بيجوا بسايد افكتس من الكوفيد فاكسينيشن. العنايه المركزه مليانه بعيانين بالكوفيد 19، مش الناس الثانيه اللي محتاجه عنايه مركزه زي اللي جالهم مثلا مرض قلب او ستروك او حاجه زي كده. زي ما قلت قبل كده الانفاكسينيتد بيشنتس هم اللي بيحتاجوا يخشوا الهوسبيتال، وهم اللي بيجي لهم مرض شديد. حاجه ثانيه ان بنسمع شائعات كتير. الهيلث كير وركرز كلنا سواء اطباء او نرسات او غيره من different specialties، ما فيش اي انترست ان احنا نحاول نضلل اي حد. احنا بنقول معلومات حقيقيه based عن credible information يعني. فاتمنى ان كل واحد فينا يتشيك السورس اوف انفورميشن بتاعه، يحاول لما يسمع على اعراض جانبيه عن حصلت من فاكسين معين يحقق في الموضوع، بدل ما يسمعه مثلا او يقراه من فيسبوك او حد يقول له حاجه ويصدقها على طول. واتمنى لحضراتكم كل خير، وطبعا اوبن للاسئله بعدين. شكرا.
شكرا يا مراد. دكتور جون رفائيل، ممكن تفيدنا برضو عن اللي انت عارفه حاصل حاليا في المستشفيات في تجربتك؟
شكرا دكتور. مساء الخير. هو انا هحاول اتكلم بالعربي والانجليزي. هو الرساله اللي عايز ابعتها للمشاهدين او الناس اللي بيسمعونا ان هو الفاكسين is effective and it works. It reduces the chances of people ending up requiring major support and intensive care. The vaccine also is associated with very, very few side effects. Unfortunately, there's been a lot of misinformation and a lot of poor messaging about the vaccine. The risk of people dying from COVID is about 2 in 100, so 2%. It seems low, and in my experience, a lot of people I've spoken with, both patients and otherwise, say, well, if I'm young and fit, a 2% risk is not particularly high. Put that in perspective, if I was to operate on someone and quote them a 2% risk, that's considered a major operation. So if I'm operating on an aneurysm, for example, an aortic aneurysm, a 2% risk is a it's not a small risk. The analogy I often use with my patients is that if we have, say, 100 M&Ms or Skittles or whatever lolly people like, and 2 of them are poisoned, and we offer them to someone, would someone randomly pick one of those lollies? I suspect most people would say no, because you don't know whether you'd pick the poisoned one or not. And I use that analogy just to put into perspective for people, for patients, when I perform surgery, about what a risk is. So a 2% risk is not a small risk. Now, if you compare that to the risk of being vaccinated, and the risks of clots, for example, with the AstraZeneca, somewhere between 8 to 20 in a million, risk of a clot. Not the sort of clots that we see as vascular surgeons, clots in the legs. They're rare clots. They occur in very, very, very unique clinical scenarios in patients who've had other problems with their platelets and so on. But they're sort of clots that occur in the brain and in the abdomen, which generally can be treated. Now, the risks are very low, but the risks of having clots with COVID are significantly higher, many, many times higher than the risks of clots with, say, the AstraZeneca vaccine. Then you look at the other risks of, the inflammation around the heart, the pericarditis or the myocarditis with the Pfizer vaccine. Again, the risks are very low compared to the risks of having exactly the same problem with COVID, which is many, many times higher. So it's a no-brainer that the vaccine reduces the vaccine side effects. Very, very rare, and there's also no question that people who are vaccinated don't end up being very sick. Now, as far as the experience that I have seen in the various hospitals, in the intensive care wards, essentially the unvaccinated are the ones who end up being very sick and ultimately die. And regrettably, the majority of these patients are from our community, which is very sad because, as Arabic-speaking members of the community, we should really be a bit more aware of the importance of and safety of these vaccines. And I think I actually appeal to everyone who's listening to us today to not be misinformed, to ask the questions of the doctors or of your health professionals, to think about the harm they're doing potentially to their loved ones by not being vaccinated. A common question I get asked is, well, if I'm, you know, how does me having the vaccine protect the rest of the community? Well, it reduces the viral load, you know, and essentially reduces the risk of you passing it on to other people. Now, I'm not a vaccine expert, but we look at statistics, we look at data, and the data is there. People who are vaccinated don't end up becoming very sick. This is becoming more and more a pandemic of the unvaccinated, and I would really like to see our community, the Arabic-speaking community, you know, hopefully lead the way in the vaccination so that we don't end up seeing all these sick people from our community in the hospitals.
طيب ندى تقدري تترجمي الكلام ده؟
أنا ممكن أقول يعني أنا عايزة أقول حاجات similar للي قالها دكتور جون. فأنا GP بشتغل في South Melbourne، والحمد لله إحنا بنعمل vaccination clinics، يعني أنا عايزة كمان appreciate الناس اللي getting vaccinated عشان في ناس كتيرة getting vaccinated، بس للأسف المسلمين والناس اللي بتكلم عربي هم دايما بيبقوا represented في الناس اللي داخله الهوسبيتال والعنايه مركزه. وحتى الشيف كوميونيكيشنز اوفيسر بتاع ديبارتمنت اوف هيلث هجتمع معاها بكره عشان هي عايزه تتواصل معايا عشان عايزين نعرف ليه احنا ككوميونتي مش عايزين ناخد الفاكسين، ودي حاجه ما قدرتش افهمها. فبكلم مع البيشنتس بتوعي المسلمين ولاحظنا ان في كذا reason. هم أول حاجة خايفين الفاكسينيشن حصل بسرعة قوي وطلع بسرعة قوي، وهم مش مقتنعين إن ده كان وقت كفاية. وتاني حاجة إن هو في distrust للأسف، like خصوصاً لما بيجي من the white man. فلما كتير من عيانيني لما واحد دكتور ما بيتكلمش اللغة بتاعتهم ولا بيفهمهم بيديهم المعلومات، هم it doesn't resonate with them. وأكتر حاجة لاحظتها إن الناس مش عايزة تسمع، يعني ما شاء الله دكتور مراد ودكتور جون بيدولنا facts و statistics، بس معظم العيانين للأسف they don't respond to statistical arguments، أنا لاحظت إنه they respond to emotional. فأكتر حاجة ممكن أقولها للعيان بتاعي إن أنا ماما وبابا خدوا الأسترازينيكا، دي كفاية. لو ماما وبابا خدوه هم هياخدوه، بس تقول لهم facts و risks وكده ما بيسمعوش للأسف. وكمان حتى مسلمين بيقولي بالذات عشان عايزيني أسمي عليهم قبل ما أعمل الفاكسينيشن. I think الelement اللي احنا ناقصينها كدكاترة في الكوميونتي إن احنا نفهم كبيشنت في logical side و statistical side، بس في a spiritual and emotional aspect خصوصا في الكوميونتي بتاعتنا اللي أنا ملاحظة بتأثر كتير على العيان. برضو الميسانفورميشن للأسف حاجة كبيرة. يعني واحد عيان بتاعي well educated هو lawyer وراح لدكتور في برايتون، والدكتور في برايتون بيقول له إن إحنا دكاترة عارفين حاجات بس ما منعنا إن إحنا نقول لكم، يعني إحنا عارفين الريسكس وبس إحنا ممنوع نقول لكم عشان كده it's all a conspiracy. فلو في دكاترة بتقول كده للأسف طبعاً الناس هيبقى في anxiety. و a part of it للأسف stubbornness، يعني الناس مش عايزين يتقال لهم يعملوا إيه. هم مش خايفين من الفاكسين، مش خايفين من حاجة، بس محدش يقدر يقول لي أعمل حاجة وأعملها. يعني دي للأسف حاجة كبيرة برضو. فأنا أحب إن شاء الله في التوك ده نحاول kind of get our community as vaccinated as possible. عشان آخر حاجة سمعتها إن في الأوستن في 40 واحد كان في العناية المركزة وكلهم كانوا مسلمين، ودي حاجة تزعل بصراحة. Yeah.
Thank you very much ندى. ندى اللي انت قلته لنا ده هو ده I think اللي احنا الناس بتوع الكوميونتي بتاعتنا عايزه تسمعه، وانا عايز اسمعه، وكل واحد عايز يسمعه ايه الاسباب ورا ان الكوميونتي بتاعتنا مش متشجعه بالقدر الكافي ان هم ياخدوا الفاكسين. بس في اخر الحلقه بتاعتنا السؤال هيكون ليكي، طب انت شايفه نعمل ايه؟ ايه الطريقه للوصول ل هنا وهنا؟ اوكي،
بس كده. ماشي،
تحلي لي المشكله دي في
إن
اخر
شاء الله.
اللقاء ده بليز.
ان شاء الله.
ثانك يو ندى. طيب هنبتدي دلوقتي الاسئله، وانا جمعت اسئله كتيره. هنبتدي عندنا هنقسم الاسئله ل3 مجموعات. مجموعه عن المرض نفسه، مرض الكوفيد، لان دلوقتي ناس كتيره قوي عندهم. يعني حقيقي انا ال3 اسابيع اللي فاتوا ما كنتش عمري اتوقع ان يكون عندي مرضى بالعدد ده عندهم كورونا. يعني كل يوم بيتصل بيا انا في الكورنتين عشان كورونا، مراتي راحت المستشفى عشان الكورونا، انا كنت تعبان وعملت تيست طلعت بوزيتيف، وبقيه الفاميلي كلها طلعت بوزيتيف. يعني دي بقت قصه خلاص عاديه جدا. فهنقسم ثلاث اجزاء. الجزء الاولاني على المرض نفسه وامتى الشخص لازم يطلب هيلب. الجزء الثاني هيكون عن المستشفيات واللي بيحصل فيها، واي ثينك ان احنا غطينا ده مع بين الدكتور مراد والدكتور جون، غطينا الجزء ده. وبعد كده هيكون في اسئله كتير عن الفاكسين، وخاصه الناس اللي جالهم كورونا وعايزين يطعموا وبيسالوا على الموضوع ده. طيب نبتدي نتكلم على المرض نفسه. دلوقتي احنا مش بنتكلم الشخص هيجيله ولا مش هيجيله، لان انا في رايي المتواضع جدا ان تقريبا كل انسان في ملبورن حاليا واستراليا ذا لارج he will be exposed to the virus. هيقابل الفيروس في الكام شهر اللي جايين. كل واحد هيقابل الفيروس. يا ترى هيقابله يكون مستعد عامل الحمايه. لو انت رايح تشتري حاجه وحد مديلك 95% ديسكاونت، I think ان اعتقد ان انت هتشتريها. 95% تخفيض هتشتريها، دي تبقى لقطه. الفاكسين بيعمل كده، بيديك 95% حمايه ان انت تحتاج تخش مستشفى او عنايه مركزه. تخفيض 95% يا بلاش. دي على فكره من صديق ليا دكتور نساء وولاده في نيوزيلاند، حكايه التخفيض دي. اوكي، نسال الدكتوره سمر. دلوقتي في عندنا عيانين كتير في البيت وعندهم كورونا، بيتصل يسال اذا كان في اي علاج، لان هو خايف يروح المستشفى ومش عايز يروح المستشفى. طيب بيسال لو في اي علاج ياخده في البيت. دي نمره 1. نمره 2، عايز يعرف امتى يبقى الوضع مهم انه يكلم الاسعاف او يروح المستشفى. العربي بتاعي اوكي يا سمر؟
Yeah, no, I understood, but I'm probably not going to be able to answer in Arabic. I wonder.
Translate after you finish,
Yeah.
but if you want to pause after 2 or 3 minutes, I can translate.
Yeah.
Rather than out again.
Do you guys think it would be helpful if I talk about what happens from an immunology, from what happens because in understanding the severity of the disease, if I show a couple of slides of what happens, so that we can then talk about the medication, because otherwise it's a little bit more difficult to talk about the medication, what people can do, and why. I know that a lot of people, I had someone say to me yesterday that they've got a batch of medication ready in case they get COVID, but just to try and understand what COVID really does. Do you think it's helpful?
As long as they only 2 or 3 slides.
Yes,
okay.
yeah, and it might be helpful when we talk about the vaccines as well. So really I want to teach everybody about the immune system and how the immune system works, and the medication that we do use, and how we help people in hospitals. So someone's going to have to make me host, and Murad, you might still be host.
You are, no, you are, Doctor.
I can share?
Yes.
Okay, excellent. All right, so what I really wanted to show is really just to tell you about our immune system. So we have the immune system هو إنه الدفاع على الجسم. You can understand me if I talk in Arabic?
Yeah.
Lebanese Arabic. Okay. لمن بتفوت الجرثومة على الجسم بيكون الخلايات البيض هني إنه الدفاع بياخدوا الفيروس. So let's say هيدي COVID بياخدوها بيبعتوا رسالة حتى يجيبوا غير مثل هلا I'm going to say it in English, it's probably easier, and then I'll leave you to interpret. So what happens is that when they recognize the virus, it's a foreign thing. So anything foreign, our body is ready to attack and kill it and get rid of it. Be it the virus, be it the bit of the vaccine. And what the body does is it sends out inflammation, and inflammation are basically signals to call other cells into the body, into the area, so that we can kill the virus. And then what happens is that they talk to these other white cells, and these other white cells either kill the virus directly, or they talk to these other cells and make what we call antibodies. And what these antibodies, and you've probably heard a lot about antibodies, and we talk about antibodies in a number of different ways, but the antibodies that come with the vaccine is basically the antibodies then go to where, if there's any virus in the body, they'll then go and latch onto the virus and to stop it from causing more problems. What happens with COVID is that this bit of the immune system is affected, and COVID reduces our white cells. And what happens is that there's a lot of emergency signal. So normally God's created us that we have a signal switch that comes on and a switch that turns it off, so that we're not attacking our own body. What happens with COVID is this off signal is reduced. And so what happens is you get lots and lots and lots of inflammation. And that inflammation is what causes COVID. Now, different people, and it's very much a different degree. So this doesn't happen to everybody. Not everybody has to go into hospital. People at home, the thing that helps us decide whether someone needs to go to hospital or not depends on how bad their oxygen, the oxygen levels are. And that's the dangerous thing with COVID. If in the lung...
How would they know that, if their oxygen is low?
Yeah, so basically when you get COVID, what happens is, so if you do a test and that test gets reported, the positive results goes through to the public health units, and those public health units basically then reach out to you and ask you a whole range of different questions, and depending on what your medical conditions are, they decide whether you're what we call a low risk or medium or high risk. And depending on where you are, they'll talk to your GP, and there are different GPs who've signed up, who put their hand up to help look after low risk patients. And then there's the high risk patients where then you get asked some more questions, and then there are potentially treatments that we can offer people who even when they're at home.
So can I stop you for a second?
Yes.
I just يعني معلش أنا عايز المعلومة توصل للشخص اللي بيتفرج علينا بسهولة شوية. اوكي الهيلث ديبارتمنت بتعرف الجي بي، وانا عمال يجي لي جوابات كل يوم على عيانين كورونا ان انا اكلمهم واتصل بيهم واسال عليهم. لكن انا عايز اعرف العيان اللي جاله كورونا امتى هو يشعر، لما يشعر بايه لازم يروح المستشفى او يتصل بالاسعاف، امتى يعمل كده؟
Yeah, if you feel unwell, if you feel like you can't breathe, you should be reaching out. Yep.
Okay.
So any of those things.
الرد ان لو حسيت ان انت شاعر ان انت تعبان جدا بصرف النظر على ايه الاعراض اللي عندك، لكن لو حسيت ان انت ان الكورونا مأثرة عليك جدا، او في حالة ان النفس بقى متضايق مش قادر تتنفس بصورة طبيعية، هو ده الوقت اللي انت لازم تلجأ فيه للمستشفى او للإسعاف.
So I was going to say, what happens is that so some people are also given oxygen probes. So you get given, so you can monitor your oxygen levels. So this is what you're either low risk, high risk. But if you are feeling unwell, then don't wait. Call the ambulance, and the ambulance comes and assesses you.
ولو عندهم الاكسجين مونيتور لما يوصل لايه يعرف ان هو في حالة حرجة.
Sorry, I missed that.
The number on the oximeter or monitor that they were given, when do they know at what level?
Yeah, so anyone who tests positive for COVID, there's a hotline. You call up, you ask for help. They're in touch with you all the time as well, and they will tell you exactly what to do. Yes, so if your levels drop to below a certain degree, then you call the ambulance. Yes, so all of that is taken care of.
هو مش الرقم بس اللي مهم، الأهم من كده الشخص شاعر بإيه، نفسه متضايق. ولو ساعات المستشفى بتدي جهاز صغير كده بيتحط على الصباع يقيس الأكسجين، لو في التسعينات الواطية المفروض إن الشخص العادي 99%، لكن لو في التسعينات الواطية اكيد الشخص ده بيكون معناه الاكسجين بتاعه واطي، وفي الحاله دي لازم يتصل بالكوفيد هوت لاين يا اما ينده اسعاف.
Nada, you had to.
Yeah, sorry, دكتورة سمر, forgive me if I'm wrong, بس أنا سمعت من كذا عيان وكمان صاحبتي بتشتغل في الآي سي يو قالت لي إن حتى العيانين اللي ما بتشعرش إن like breathlessness ده ممكن يحس إن هم مش that bad، بس للأسف بيدخلوا عندها والأكسجين بتاعهم 86 مثلا. حضرتك بتشوفي كده كتير؟
Yes, so that's very. So someone might look, and this is quite unique to COVID, is that someone might look okay, and I think Murad would be better able to tell, but the person could look very well to you, but when you measure their oxygen levels are low, which is why the public health unit do supply, so they do supply the oxygen probes, because it's a way to help pick up potentially bad COVID when a person may not feel it.
All right, السؤال لي
So can I just come back to you asked what treatment. So one thing I did want to say, so we do have treatment for early COVID, but I know this is something I see in our community very often, is that people don't present for testing early. They'll wait to either be late or until they're not picked up until they actually are needing oxygen and need to come into hospitals. They're presenting very, very late. One thing I want to say is that we do have treatments that we can give people early, but we need to know, we need to pick up COVID with very early. And the treatments we can only give if you've started symptoms within 5 days. So if you present after those 5 days of you having symptoms, it's too late, and we may not be able to give you a treatment that can prevent bad COVID.
So present means coming to hospital.
Come to hospital. So get tested as soon as you have any symptoms. And the type of symptoms.
They got tested and their symptoms are mild and they are at home. Yeah. Do they need any treatment?
This is what I'm saying. So any symptoms you have, get tested early, because within 5 days of you developing the symptoms, if you fall into the high risk category, we can offer you treatment that will prevent you from becoming sick, that will help prevent you
Right.
from
But
becoming sick.
just to clarify again, so you want the person to test early, they will.
Test early.
They
Test
got-
early.
They got positive. They got results positive. And they're diabetic and have hypertension، يعني عنده سكر وعنده ضغط، يروح المستشفى على طول يعني أول ما يعرف إن هو positive يروح المستشفى؟
No. So this is what I recommend. If you're feeling unwell, then definitely go to the hospital. But if you develop anything, a runny nose, a cough, a fever, get tested early. Your result, the average result, comes back within 24 to 48 hours. As soon as the result comes through, you will be contacted. And that's when, as the public health unit, you will be screened for the severity of COVID. And at that point, they will, if you fall into the severe category or moderate to severe risk category, you're offered treatment. If you're presenting too late, then at that stage, it's too late. We can't give you the treatment. So it is very important you get tested early so that you're picked, even when you're mild, even when you're not sick enough to be in hospital, we can offer you treatment very early on if you are high risk.
I think the problem Samar in يعني صعب قوي على الناس إن هم يعرفوا are they really unwell or not. They get tested. Of course they feel unwell. بس هو مش عارف في أي مرحلة، ما هو I'm unwell عشان عندي كوفيد. في أي مرحلة أنا محتاج أروح المستشفى علشان خاطر آخد ال early treatment اللي هو within 5 days. وعادة الناس they don't get very sick in the first 2 or 3 days. It takes a little while. So
Exactly.
I'm just not certain really الناس تروح إمتى المستشفى وتعرف إزاي إنها تعبانة للدرجة دي. يعني أغلب الناس بياخدوا الكوفيد وبيقعدوا في البيت.
So this is the whole point I'm trying to make, is don't wait until you're feeling unwell and really sick to get tested. Get tested early. When you first get that runny nose, headache, when you first get that cough, get tested early, and don't wait until you're really, really, really sick and feel like you need to go into hospital.
I think there's a bit of loss of translation. So
maybe.
So essentially, as GPs, we have COVID positive patients, and they're always calling us, and they're like, "When do I go to hospital? I'm a bit breathless, but I'm not sure I'm that breathless to go to hospital." So I think what I'm gathering, Dr. Samar is saying that the DHHS is calling them on a regular basis and screening them on a regular basis, and will let them know when they're screening highly. So I think we've established, and like you're both saying, get tested early. And I think the screening as to whether they should go or not will happen by the DHHS on their calls.
Yes,
is that right?
That's right. So there's a process that's followed, and the pathway that gets followed that will help patients just to go into the hospital.
الديبارتمنت هيكلموكوا لو عندكم كوفيد regularly وهيسألوكوا كذا أسئلة وهيعرفوا لو هتحتاجوا تروحوا المستشفى ولا لا. ده اللي حضرتك كنت عايز تقوله يا دكتور مجدي؟
لا أنا يعني عايز أن الأمور واضحة أكثر للناس، يعني لأن هو أنت عندك ويندو في أول 5 days بس عشان تاخدي العلاج، لازم تبريزنت في خلال 5 أيام. الناس they are not very unwell في الفترة دي، إنه ما يقدروش يعرفوا they will get very unwell ولا لا.
Do you want to ask it in English? Maybe I'm misunderstanding.
Yes, العلاج ده so this treatment is only available through the hospital, not through their GP.
No. So you can be at home. What happens is there are clinics that are designed so you could be mild, you don't need hospital. What happens is that you have your treatment in this clinic, you go back home. Yeah, so you don't necessarily need hospital at that point. And the idea of this medication is to try and reduce your chance of needing hospital.
Had this medication been changed along the way, Samar, or what is the protocol now?
Yeah, so basically this is a medication that is being used around the world. The medication is called sotrovimab, which is an antibody. So similar to how we make antibodies when we get the vaccine that help protect us. So the scientists have made this antibody that helps get to the virus and try and stop the virus from causing more damage. And so it's an antibody treatment that we give, but because it works only when it's given very early on in the course of infection, that's why I encourage you all, if you do have any symptoms, get tested early, because the sooner you're discovered as having COVID, if you are high risk of bad COVID, then you can get given this treatment. You can get it and go back home, and hopefully it'll stop you from needing hospital. Doesn't always work for everybody, but that's the idea of this treatment.
Thank you very much. Can I ask one more question? Now, these are not my questions, على فكرة, Samar. These are questions that I've collected from people. Some are asking if vaccinated people transmit less than unvaccinated.
Yes.
يعني السؤال، هل الشخص اللي هو متطعم احتمال ان هو ينقل المرض اقل بالمقارنة بالشخص اللي هو مش متطعم؟
Yes, definitely. So the benefit of the vaccine is two different things we look at. One is how likely is the vaccine able to protect you from getting sick and getting bad COVID and dying? And all the vaccines are fantastic at doing that. They're all, more than 90% chance of protecting you from getting bad COVID. The second thing is getting any infection and transmission. So for you to pass the infection, you need to get infected and be able to then cough it up and spread it that way. That's how the virus gets spread. With the vaccines, depending on which one you have, the protection against any infection is different. So AstraZeneca, when you're double dose, that protection rate is about 70%. So essentially it's reducing your chance of getting any infection by 70%. And so, and the Pfizer vaccine or the mRNA vaccines, that is even higher. That's more 85%. And so if you're not going to get the virus, you're less likely to pass it on. And even when you do get the virus, the load, how much virus is in you to be able to pass it on, is also reduced. So, and we're seeing this all around the world, where places, and even in Sydney, their numbers have gone down, not just because of the lockdown, we've got lockdown as well, but because they're getting vaccinated. And the more you vaccinate, the less likely you pass on the virus.
So باختصار شديد، لو انت ما لقطتش الفيروس ما تقدرش تعدي اي حد. If you don't catch it, you can't transmit it. Can I go to Dr. Murad and ask him, please, what do you think behind the whole fuss about this vaccine?
سؤال كبير يعني. هو للأسف زي ما اتقال يعني هجاوب بالعربي صح؟ اوكي؟ للأسف هو الناس confused، بيقولوا أنا healthy، أنا مش هيحصل لي حاجة، زي اللي بيحصل مثلا، يعني سوري يعني للناس اللي بتدخن مثلا، بس يعني زي الناس اللي بتدخن وبتقول أنا أوكي مش هيحصل لي حاجة. فبالنسبة للكوفيد، هو بيقول أنا كويس، أنا healthy، أنا بمشي، أنا بقدر run 10 miles، مش هيحصل لي حاجة. لو أنا أخذت الفاكسين هيعمل لي إيه؟ أنا سمعت إن في side effects كتير، في ناس قالت لي، هقول لحضرتك حاجة مثلا، أنا دي حصلت يعني في عيلتي. أنا واحد بيشتغل في الاير كونديشنينج، جه قال للفاميلي ممبر بتاعي you should not be vaccinated، ما تاخدش الفاكسين ده بيعمل كذا وكذا 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 كذا. الشخص ده طبعا كلمني في التليفون، قال لي ايه اللي بيحصل ده، انا ليه اروح اعمل فاكسينيشن وكده. فطبعا يعني للاسف الادفايس بتيجي من ناس ما هماش بروفيشنالز، مش بيشتغلوا في field. وزي ما انا قلت في البرزنتيشن قبل كده، احنا مش عايزين نمسليد اي حد، احنا مش بنحاول نضحك على حد، احنا بنقول حقائق. الحاجات دي احنا بنشوفها day to day. انا بعمل ميتينجز every day في الهوسبيتال عشان نحاول نمانج موضوع الكوفيد 19. فللاسف الناس بتسمع الكونفليكتنج ستوريز، يعني حد بيقول انا حصل له كذا من الفاكسين ده، طب انا كويس، ده انا مش هيحصل لي حاجه. طبعا بتعمل كونفيوجن وبتعمل فص على حكايه الفاكسين.
دكتور مراد، يا ترى حضرتك وزوجتك والاسره كلكم طعمتوا؟
انا وزوجتي وبنتين الاثنين كلنا fully vaccinated.
Samar, what's your vaccination status there?
Everyone's vaccinated. Every single one of my family members is vaccinated. My parents, just like my two parents, have received the AstraZeneca vaccine.
Very good. Nada, you already told us that all your family is vaccinated. John?
Yep, everyone's vaccinated, fully vaccinated.
I don't think we'd be giving this talk if we weren't vaccinated, I think.
We need to, however, address some of the barriers. Sorry, Dr. Go ahead.
Yeah, sorry, Fad.
No, I was just saying, I think we should really we should really challenge head on the barriers to vaccination and the myths, because we all clearly, we can be, the problem is people think we are pontificating to them. We're not trying to preach. We obviously believe in vaccination, but I think need to break down exactly and be bold. Like, for example, Nada, obviously, very, very experienced, wonderful GP of Arabic background, Muslim background. I mean, we have people saying, there are some people, and I'm sorry, I'm just being bold and facing the facts. People are saying, well, some of our religious leaders have discouraged us from having the vaccine. I've had people said some of my GPs have discouraged us from having the vaccine. So I think we really just need to think about confronting these myths head on, because we can put our head in the sand, but unless we acknowledge that there are real issues there, and some of I've had discussions with very intelligent people. I've had discussions with academics in other fields, engineering academics, for example, who have read literature that has completely convinced them that the vaccine is dangerous. So I think we really need to maybe not focus on maybe some of the myths that we've all collectively heard, because I think ultimately that's what's going to try to better inform our communities, because I think it's and it's not a comfortable conversation to have, because some of these myths are crazy, and some of them may have some reasonableness to it, and we need to acknowledge, I guess, as a body of medical professionals, that maybe there has been conflicting messages, there's been maybe incorrect messaging, maybe the lockdowns have caused people to be very fatigued and the compliance has become very limited. People don't like to be told what not to do, and I think I think we need to probably address some of these real issues, and I wonder whether yourself, Dr. Magdy, and Dr. Nada would be happy to discuss that. But anyway, I'm sorry to interrupt, but I think it's important, because the myths, I think, are, in my opinion, humble opinion, the biggest barrier sometimes for people to get vaccinated.
Absolutely, and happy to address any of those myths, because I think they're all stem from poor knowledge and fear, and I think we can address happy to address all of them now if you like.
Okay, so ممكن معلش أنا بس بقول أنا والدكتور مجدي نسألكم الأسئلة اللي إحنا بنسمعها من عياننا أكتر، يعني أسئلة، ولو تقدروا على تجاوبوها. هنبتدي ممكن نقول the reasonable ones والحاجات اللي يمكن إحنا شايفينها unreasonable بس برضه نأدرس. فحضرتك
اتفضلي يا نادي ستارت.
فأكتر حاجة بسمعها إن الفاكسينيشنز خدوا 2 سنين بس إن هم يصنعوهم. احنا ازاي هنعرف اللونج تيرم افكتس؟ ايه الجواب بتاعكم لده؟
Okay, you want me to go first? Okay, so as I was saying before, God has given us this amazing immune system.
Okay.
Hello? It turns on and then it turns off. And so what happens is we get the vaccine right in our arm. It gets picked up just like the virus does. It goes into our glands, which sit under our arm and our neck here. The body, because that's what we're designed to do, we pick up the vaccine, we do what we need to do, and then everything gets destroyed by the body. So, and that process, switch on, switch off, by 6 weeks, it's like we've never had a vaccine, just like it's like we've never had a virus. So any side effects we are going to see, we're going to see in that period when our immune system is activated. And that's when we see. So everything we see, whether it be the inflammation around the heart, whether it be the clotting, any of the effects we see within the first, really within the first 2 to 3 weeks, really. But may extend up to 6 weeks. And historically, with all the vaccines we've had over all these years, we really don't see any side effects beyond that. So I know people are scared of cancer risks and fertility risks and all of that, but we really don't expect any, because that's not how our body works. That's not how vaccines work. So anything we're going to see early on.
Any comments, Samar, on how quickly it was developed? Because that's often the question.
Yeah. I've got a slide that really kind of highlights that. But basically with the vaccines, what happens is there's lots of red tape with any research that we do. So I wonder if it's helpful for me to, I won't show it, but basically what happens is, firstly, we test things on animals to make sure that they're safe. And then we test them on a handful of people to see that, again, make sure they're safe in humans and to work out the right dose. We then test them on a bigger group of people to make sure they're safe and they work before we test them on a really big number of people. Each of those steps takes time, and because we have to wait for the result, publish the results, then start, then move on. And so sequentially, all of those steps take a lot of time. What happened with COVID is that we're in the middle of a pandemic. So the urgency was there. Lots of money was given to the research so that it was happening not like this, but more like this, overlapping. So we were starting the next step before the first step was finished. And everybody was working together. And when people do things together, it gets done quicker. Not to mention all the volunteers as well. So for us to collect a few people, it takes time normally. But when you have a pandemic and you have people, and we're seeing people get infected, so we can see the effectiveness of the vaccine much, much quicker. Unlike let's say, a meningitis vaccine, where meningitis generally is rare and we're using it in a small population of kids. So for us to actually see the effects takes a few years. Whereas when you're right in the middle of an infection that spreads really quickly, we can see the effects really, really quickly, which is how all of those studies happen really quickly. And in fact, the number of people that were studied were so many more than what we would do normally in a vaccine. Some of the Pfizer vaccine had about 35,000 people. The AstraZeneca vaccine had about 30,000 people. So even though it happened quickly, it was condensed. No steps, none of the safety steps were no corners were cut. None of it was cut out. And the same process that regulates and proves vaccine, that was followed.
Another question from a young person. That's just part of all the myths. They say that all the people who are vaccinated, they will die in 2 years. Yeah.
There's absolutely no biological basis to it whatsoever. Again, for the same reasons I mentioned, nothing stays. All of it. I mean, what it is basically sugars and salts and magnesium and all of that. Nothing stays, and so it's all you're not getting more than what you're getting in normally in the environment. So no truth.
It's not true that 80% of the population are going to vanish in a couple of years.
No, and I don't know how these rumors coming about when the vaccine hasn't been around for 2 years. So people are making this up, that these are not things we know about. And the same with fertility. Fertility is another one that gets thrown around a lot.
Yep.
We in fact know that part of long COVID, after people have COVID, especially men, their sperm, their fertility, if anything, is reduced because COVID goes everywhere. Whereas this is a study that was done to address the same issue where men were given the vaccine and then their sperms were tested and looked at, and the motility of the sperm actually was better up to the vaccine. And so there's really no biological basis at all for the fertility. Nothing gets into the
I need to translate that, Samar. I need to translate that.
Sure.
So السؤال كان على الآثار الجانبية بتاعت الفاكسين من خلال اللي احنا بنسمعه. يعني في اللي وصلوا قال لك ان هو بيأثر على الحمل وبيأثر على الرجالة في القدرة الجنسية، وبيأثر على الستات في مقدرتهم للحمل، وفي كمان اللي راحوا لغاية ما قالوا ان كل الناس اللي اتطعمت دي بعد سنة هيموتوا بعد سنتين. فكلام ملوش اي حقيقة، اي اساس من الصحة نهائي. العكس هو الصحيح، ان الناس اللي بيجي لهم كوفيد، اللي بيجي لهم كورونا، دول اللي ممكن يتاثر الحمل بتاعهم. واكشولي الدراسات بتثبت ان الرجاله اللي بيجي لهم كورونا ده بيأثر على عدد الحيوانات المنويه والحركه بتاعت الحيوانات المنويه اللي هي مهمه طبعا بالنسبه للحمل. فالرساله ان مش الفاكسين هو اللي بيخوف، كورونا هو اللي بيخوف. ما نخافش من الفاكسين، المفروض ان احنا نخاف من الكورونا. next question ندى.
ممكن اعلق بس على الموضوع ده. عايز اقول يعني حاجه يعني just بالعقل كده. يعني طبعا هو السؤال كويس ان ناس خايفه من الفاكسين ما كانش موجود بقاله فتره طويله، بس يعني عايز اقول احنا ليه عايزين نعقد الموضوع؟ احنا قدامنا الداتا بتبين لنا، وقدامنا برزنتيشن بتحصل every day في الهوسبيتال. الناس بتخش الهوسبيتال بالكوفيد 19 ما بتخشش بمشاكل من الفاكسينيشن. وزي ما الدكتوره سمر قالت الحاجات دي هتحصل، لو حصلت هتحصل في الاسابيع الاولانيه. احنا الرول اوت بتاع الفاكسين شغال من بقاله شهور. فيعني ليه انا افكر في حاجه خياليه قدام هتحصل بعد سنه سنتين وكلام ملوش اي معنى طبعا، وانا قدامي حقائق بتبين انه اللي هيجي له كوفيد ومش فاكسينيتد هو اللي هيخش الهوسبيتال، واللي فاكسينيتد هيتحمي من الكوفيد. الحاجه الثانيه اللي عايز اقولها برضو يعني بالعقل كده، يعني الفاكسين ده بيمثل حاجه بسيطه جدا اللي هي اللي بنسميه السبايك بروتين. يعني بتمثل زي السبايك بروتين لما يخش الجسم يعمل مناعه ضده. ما هو الواحد هيجي له مناعه ضد الكوفيد ازاي؟ يا اما ياخد الكوفيد نفسه، يا اما نديله الفاكسين عشان نعرف الجسم على السبايك بروتين. فيعني في تخيل اي حد، حتى لو واحد متخيل ان الفاكسين ممكن يعمل ضرر، طيب الفاكسين ده جزء بسيط جدا من الفيروس. تخيل انك هتاخد الفيروس كله، يعني الكوفيد كله هيخش الجسم. اكيد طبعا ان ده هيبقى much worse، اكيد ده هيعمل اذى اكتر، مش الكوفيد، مش الفاكسينيشن يعني.
وفي العالم بتخاف انه بيكون السبايك بروتين ماشي بالدم وبالخلايا الجسم، النسبه اللي بتفوت كثير صغيره، بينما لما بيكون الفيروس بتنتشر بالدم، انه بيكون اكثر واكثر. So we just, I think people are scared of these things, but really if you think about it, COVID is so much more than the vaccine.
Can I just interrupt for a second? The issue here is that there is a lot of misinformation about the vaccine itself, and I think we need to make parallels with other vaccines that have been used for other diseases, for other respiratory illnesses, and other viruses and bacterial illnesses. But I think it's important because it's part of in my simple experience, the fact that access to the vaccine was a bit staggered, has developed this fear in people's minds. So I think if it's possible, can we address that question? Also, the question I was asked today, in fact, I was asked two questions. Why is there a need for ongoing boosters? And then, can I pass COVID onto my loved ones or my family if I am vaccinated? And it's not so much if I catch COVID, does the vaccine itself allow me to then pass COVID on? And, you know, if we can get some commentary on those questions, that would be wonderful.
Yeah, so let me address the first question. No, you cannot pass COVID on from the vaccine. So what we give with the vaccine is a message. It's a tiny little message that only gives it sends makes the spike protein, which is really just a protein on the outside of the virus. So nothing of the virus itself goes in, and the spike protein on itself isn't able to do anything really. So all it does is teaches our immune system to then recognize the virus when it faces the real thing. So we don't have the machinery. There's not the right amount of DNA or RNA in the vaccine to then make virus itself. And so when you can't make the virus, and you cannot pass it on. But some people, and I know it's actually quite common in our community, is that some people are going to get vaccinated, but they've actually got symptoms or just about to get symptoms of COVID. And a lot of people are testing positive soon after they've had the vaccine and presenting to hospitals with side effects of the vaccine, when supposed side effects of the vaccine, when really they then test positive for COVID. It's not the vaccine that's given them COVID, it's that it takes time for the symptoms to develop, what we call an incubation period. So when we get a virus, it takes time for it to grow before we get symptoms. And unfortunately, a lot of people are presenting when they've got COVID to get the vaccine.
Can you just comment on just for the public's community, sorry, for the public's, the audience's, I guess, general knowledge? I mean, just a commentary on vaccines that have been effective for other illnesses and the ongoing requirement for boosters, if you don't mind.
So
Dr. Murad or Dr. Samar.
Yeah, so the second question to address. So the staggering of the vaccine, why it's been different and in terms of dosing and all of that is because it comes down to a priority. Now, unfortunately, we didn't have the supply, the right amount of the supply. And if we had from the beginning, then there'd be less confusion. I do have to say, and that's partly what's driven the confusion, is because, you know, we said these people can get it, then these people, and then we changed our mind. We said, let's give it at 3 weeks, but then we said, let's give it at 6 weeks. So a lot of confusion there. But the reason why those decisions were made is because we started to get COVID in the community. And that meant that priority had to change. We needed to protect the patients that are most vulnerable, the older people, the people with immune problems, and our healthcare workers, because they're going to be facing COVID more. And so that was the case. And then as numbers started to grow, we needed to narrow down the staggering and the timing of the vaccine, because we needed to get people their first dose of vaccine, as many people as possible, because we know that first dose is still, you know, very important and protects, you know, 70% at least against bad disease. And so that's why that got extended out. But then when we got the vaccine and we had lots of vaccine and we needed people to get their double dose, that was shortened back down to 3 weeks.
So we responded to the situation that we had on the ground. It wasn't
exactly. It was a living situation.
Nothing to do with the actual efficacy or mechanisms of action of the vaccines.
Not at all. So it was really just facing the situation and trying to protect as many people as possible.
Well, thank you very
Dr.
much.
Murad, any comments? Any further comments that you have?
Yeah. So I just wanted to say that, you know, with other vaccinations, we do also need boosters. We need to, like, for the flu vax, for example, every single year we have to get a new vaccine because there are new strains. For example, the hepatitis B vaccination, you have to have 3 doses to have enough immune response. when some people actually get good enough immune response after 2, but the standard is 3. So basically, you will need to get a booster vaccination. You'll need to remind the immune system again about the virus, so it continues to fight the virus if someone gets exposed to it. And as was mentioned earlier, it's only a matter of time before we all get exposed to it, and we have to have good immunity.
Yeah. The other thing. Sorry, I was going to say.
Boosters are a normal part of. Sorry, Dr. Samar. Boosters are a normal part of vaccination. Is the
yeah, but also it's a normal part of the fact that we've got a living situation. COVID, we're learning things as we're going along. It's not. In that, people shouldn't look at that as a bad thing. It's because we're gathering the information, and studies are now coming out showing that after 6 months, the protection against any infection does reduce with time, but importantly, the severity and protecting against severe disease is lasting. Okay, but the reason why we need to give boosters, especially to those at the moment who are not able to mount a good response, like people who are immune suppressed, they're the priority, which is why now we can only give 3rd doses to those people. But eventually, it's only a matter of time. We'll open up to the elderly people, because elderly people are not able to respond as well either. So it'll be a moving situation. It will change, and it might cause confusion, but we're learning things as we go along. And as Dr. Murad said, booster doses, they're not unheard of. We do them all the time. However, what we are seeing is that those 3rd doses are significantly improving immunity, and time will tell whether we need more every year. At the moment, it's looking pretty good. So yeah, but we're learning all the time.
أنا بس عايزة أضيف نقطتين لو ممكن على ده. أول حاجة أنا حاجات بقولها للعيانين أطمنهم، لو أنتوا كنتوا feeling okay إن تاخدوا polio measles mumps rubella 30 years ago، من 30 سنة لما technology was much older، دلوقتي technology much newer. ليه بنخاف دلوقتي؟ وهو الجواب لده social media، عشان social media والحاجات دي هي اللي بتخوفنا. وتاني حاجة بس عايزة أضيف عشان الستات اللي بترضع عشان أطمنهم، دكتورة سمر قالت إن كان في يعني بس قليل قوي من الفاكسين في الدم، وكان واضح في استادي عملوه على الستات بيرضعوا في الحليب نفسه ما لقوش أي mRNA ولا أي فاكسين في الحليب، بس لقوا المناعة والأنتي بوديز فيها. فده بيوضح أكتر إن لو خدتوا الفاكسينيشن، هو الفاكسين نفسه بيطلع من البودي، عشان دي حاجة بتخوف ناس كتيرة، وتطمن الستات اللي بترضع برضو يعني عشان بيقلقوا كتير من الموضوع ده.
وبذات الموضوع كمان pregnant women بيخافوا إنه الvaccine will affect the babies, but in fact it's the other way around. Pregnant women more likely to die of COVID, especially when in the 3rd trimester, whereas the vaccine protects them, and that way protects their babies, and the antibodies go through to protect the baby. And we know that babies in their first year within that first year, they're a higher risk of COVID. But if the mum is vaccinated, mum is able to pass the antibodies to baby and protect baby, which is very important, because we can't vaccinate the babies at the moment.
طب السؤال ما اعرفش لو دكتور مجدي بتسمعه كتير، بس عيانين كتير دلوقتي يقولوا لي احنا مستنيين النوفافاكس، عايزين يستنوا لغايه قبل كده كانوا مستنيين الفايزر، وقبل ده كانوا مستنيين حاجه ثانيه. فرأيكم ايه في النوفافاكس؟
I hear that all the time, and the reason why people want Novavax is because it's old technology. It's what so Novavax for people is what we call the subunit vaccine. So we give we actually give the spike proteins, and we give a substance with it that then strengthens the immune system to respond. A lot of vaccines are like that, and they work. They're very good vaccines. But at the moment, the evidence for Novavax isn't there, and it's not yet been approved. So it's looking like it probably will work, but it's not yet approved for a number of reasons. And so it hasn't gone through all of those steps. And so they're waiting for something that as yet may not go through the right steps, and we may not see that it works. And so I think what's important is that you want to avoid getting COVID now, because it is going to move around in the community. Waiting for something that may never come and may not be as effective as what we have now is not a good idea, because you get COVID, you can pass it on to someone who may not be able to respond to the vaccines. You can get long COVID. Even if you get mild COVID, even if you stay at home, you don't need hospitals. Long COVID, which is a condition we see with COVID, can affect anybody. And the effects of long COVID are not very nice. It can cause people to lose memory, to get really tired, get chronic fatigue. And so a whole range of different things. And so you want to get the vaccine, you want to get it before COVID is everywhere, you're going to get it.
Can I make just one comment? In terms of the GP, our GP colleagues' experience in terms of barriers to getting vaccinated, are there other barriers such as language barriers or access barriers, and what can we do as a group of Arabic-speaking medical professionals from various backgrounds? What can we do together to, I guess, other than just dispel the myths, what can we do to facilitate and maybe help overcome the barriers that we're seeing practically? Because we need to think about the Giddu and the Teta and the Baba and the Mama who are staying at home, who want to get vaccinated. They think they should get vaccinated, but how do we, because, you know, in any human behavior, you need to acknowledge that there's a problem and acknowledge there's a solution. And then the second step is, how do I then actually effect that solution? And I guess we're all privileged that we're talking from, you know, as medical professionals, we have ready access to these things, but we I guess, our esteemed GPs are in the excellent position to give us advice on that. But, you know, from the very practical, let's say 75-year-old, you know, non-English speaking, you know, elderly gentleman who lives in a commission house who needs to access COVID, what can we do to improve access, I guess, collectively? And I'm just leaving it to everyone maybe to make a comment. Maybe Dr. Murad, because I know you have to maybe head off soon. Maybe give us a, you know, your wise insight.
We need to just be aware of time, because we have to.
Sorry, yeah, okay,
very
no
soon.
problem.
So yeah, Murad, final word.
Sorry, I missed some of what you said, John. Quickly, just remind me quickly.
Sure. Just in terms of just looking at very simple grassroots, you know, your simple, not simple, sorry, the members of our community, for example, the elderly who may have language barriers or access barriers to the vaccine. What can we do collectively as a bunch of medical professionals who are from an Arabic-speaking background? What can we do, or what should we be thinking about to help improve access and maybe overcome the barriers? Not so much dispelling the myths, because, you know, we know there's a lot of myths and we can spend all night talking about the myths, but what are the practical steps we can take to try to, you know, improve access and maybe overcome barriers?
Yeah, look, very, very good suggestion. I think الكلام بالعربي actually. Yeah. So I think إن إحنا ممكن يعني إنه contact الناس اللي إحنا نعرفهم. لو أنا عندي patients، لو أنا عندي ناس في الكوميونتي بتاعي، لو أنا أعرف ناس على الفيسبوك جروب، يعني أنا استعمل السوشيال ميديا زي ما هم بيستعملوها، بس بيسمعوا حاجات مش مظبوطة. نكونتاكت الناس دي ونتكلمهم يعني ونشجع الفاكسينيشن. هنضطر نحط طبعا حقائق علميه عشان الناس الموضوع يبقى كريديبل، يعني الناس تصدق. بس لازم يعني كل واحد فينا يكلم قرايبه، يكلم اصحابه، يكلم الكوميونتي بتاعه. We spread the word, whether it's by mouth or by email or SMS message or whichever means. Yeah.
Dr. Magdy, if I could add something to that, you know, following what John was saying, really, it's when it comes to our community. They could relate to environments that they know. So we've seen it where the uptake has gone really high when vaccination was introduced at a school level, you know, in terms of religious schools and churches and mosques. And, you know, so from that point of view, I think in terms of accessibility, you know, if we can go down to that, as you call it, John, grassroots environment, I think that will go a long way. The other thing also, from a non-medical perspective, we need to acknowledge how our community has taken on this challenge. And so we've been talking about our community as lagging, and they are, we are lagging, but we need to understand that the statistics are telling us where locations where our communities are residing has come a long way. There were times there when the overall vaccination rate was at 50% first vaccination, and some of our communities or suburbs that where our communities live were hovering around 25-30%. First vaccination now is, as we know, is close to 90%, and some of our communities are as high as 65%. So they're coming a long way, and I think we need to acknowledge that.
Definitely.
We were talking not long ago, maybe a month or two, we're talking about the majority. I think we're now talking about a smaller portion that we need to target, rather than it's a widespread. I think our communities have come a long way in terms of really understanding and taking on the challenge.
عبدو، أنا ممكن أضيف إن أنا في ملحوظة واضحة، معرفش ندى هتوافقني ولا لأ، بس أنا لاحظت إن ناس كتيرة من our community ما بياخدوش التطعيم عشان في ضغط من أولادهم. أولادهم ضاغطين عليهم ومنعينهم إن هم ياخدوا التطعيم. وكان أنا عندي أهل جم من وراء ولادهم وقالوا لي إحنا عايزين نطعم، بس بليز ما تقولش لابننا فلان أو فلان، علشان خاطر قالوا لي يا ماما أنت تقعدي في البيت وإحنا هنديكي فلوس وما تروحيش تاخدي التطعيم. يعني it goes to that. So sometimes the problem actually is in the younger group. احنا هنا بنوعي بالعربي كل الاولدر جروب عشان يبقوا واعيين، لان معلش برضو ده مجرد my observation. I think ان احنا كمهاجرين واولاد المهاجرين they're more sort of susceptible to the conspiracy theory, or maybe more, they're difficult to trust. They don't trust easily. So there is an issue here being able to trust. And so that comes on in variety of situation, and it has actually showed up also in this situation. So it is just an observation that I keep seeing. And in fact, things are changing, like Abdu saying. يعني أنا دلوقتي عندي مثلا أسرة أنا أقنعتهم إن هم لازم والدتهم تطعم، عندها سكر وكذا، عندها أمراض كتيرة قوي، والأولاد ما كانوش موافقيني. طعمنا الأم من أسبوع كل الفاميلي جالهم كوفيد. الأم ودوها بيت تاني ومعيتش. كلهم دلوقتي النهارده جايين يطعموا وعرفوا إن اللي اتعمل كان صح، وبيشكروا إن أمهم اتعملت. الفير كمان is driving vaccination، لأن مفيش حد دلوقتي ما يعرفش حد عنده كورونا. يعني تقريبا كل واحد يعرف حد أو أسرة بحالها. واللي بيتكرر كتير بقى في التليفون ان اقول له، فيتصل بيا يقول لي اصل انا عندي كورونا دلوقتي وعايز ورقه علشان خاطر اقدر اروح الشغل. فاقول له ما طعمتش ليه من زمان؟ قال لي تصدق يا دكتور believe me انا I just booked it بس جالي كورونا قبلها على طول.
Yeah.
So
I think Dr. Samar was talking about that as well earlier. بس يعني
هذا رسالتك الأخرانية to your patients.
goodness. رسالتي الأخرانية.
Would you like to tell them something?
عايزة أقول لهم حاجة، راحوا التطعموا. ممكن لازم تطعموا. وخصوصا I appreciate زي ما حضرتك بتقول دكتورة عبدو، إن الناس ابتدت تطعم، بس للأسف ال Chief Communications Officer قالت لي إن ال Northern suburbs are really doing well بس للأسف ال Southeast و Dandenong هم دلوقتي they're trying to target وللأسف عشان في influencers على social media ال youth هم المشكلة إن هم بيسمعوا ال influencers دي ف I think إن إحنا لازم somehow to get to the youth مع ناس يمكن هم they can relate to و in terms of accessibility في سيدني كان في دكتور he took a van and he drove around the western suburbs والحمد لله بعد ما عمل كده لقوا ان ال western suburbs فيمكن دي حاجة ممكن اقولها لهم ان يمكن تفتكروا موضوع الفان ده انه يروح to people's homes with that help. Do you think?
I think bring the vaccines to the bring the message to the people.
Yeah, so they are. So actually, quite a lot of initiatives are happening, even in Southeast Melbourne. And I can only comment for that. They've got lots of pop-up clinics that are happening, and they are moving around to try and focus on community. And I know that happened a lot in the West, and that actually helped push up the numbers of vaccination in the West. And even culture sensitive, women, separated from men, and a number of different ways to try and help. Vaccination.
And Samar, I wonder whether they should also maybe be not necessarily staffed but overrun by people, because as Dr. Magdy said, there is an element of this sort of white person mistrust, which is regrettable, but it's the real, and we have to acknowledge real things, the elephant in the room, so to speak. And so I wonder whether if it's run or overseen by people who are recognizable members of their community, whether that elevates the level of trust in the system, because at the end of the day, we've been locked down. We haven't been locked down. We've had access to vaccines. We haven't access to vaccines. There's mistrust. We need to acknowledge that.
Yes, absolutely.
And then I think we need to maybe have figures of some figures of some trust to maybe be involved in that. And I just wonder whether that's something Nada would be worthwhile passing on, and I'm sure members of our community would be only more than happy to be involved. I speak on my behalf, but I'm sure on behalf of everyone else.
I think there's still a lot of myths and questions and fears that people have as well. And I think, unfortunately, in terms of time, even something as common that I get asked a lot of the time is it going to have an effect on my DNA? So there is, unfortunately, still, while all of those things are really important and we need to get the vaccines to the people, and then for them to then be able to make their decision, a lot of what is stopping them is fear. So look, I'm happy to address some of those.
Also say something that's non-medical, and I'm not a sheikha, but I always hear this about like موضوع التوكل، إن الناس كتير بتقول like أنا بتوكل على ربنا لو عايزني اخد كوفيد هيجيلي كوفيد. دي حاجة بسمعها من معظم المسلمين، بس عايزة بس إن أنا أقول like ربنا ادينا the means to avoid that، فلازم نعمل علينا وبعدين نتوكل على ربنا. Like I don't think that's an excuse, and we've got several examples in our religion that you have to do what you can and then نتوكل. I know it sounds fluffy, but that's a big thing.
No, and it's not just the Muslim religion. So even I have a lot of my Christian friends are exactly the same. Leave it to God. If I'm going to die of COVID, if I the way as a believer in God, really, I think anything that comes, anything good, God is merciful, and anything good that comes from God. And he didn't. I don't believe he sent COVID, and he's sending us the solution. And I truly believe that this is the solution. His way. Doctors didn't come out. Scientists didn't come out of this completely without God helping them.
I mean, the idea is as a religious community is for us to do our best, which is to be vaccinated, to trust the doctors, and then leave the rest to God. That's what it is.
So Samar, sorry, Nada, the truth is it's not just the Muslim. I think it's sort of more cultural rather than religious, because I've seen it across the religions. The one common thing is cultural background. But we have to wrap up now. So I want to thank all the panel members for great meeting and very useful. واعتقد هو ده اللي نقدر نعمله ونفضل نعمله علشان نوعي الناس اكتر واكتر، وان شاء الله يكون في لقاءات جايه كتيره علشان خاطر ننهض بالكوميونتي بتاعتنا. Thank you very much.
Thanks again.
Thanks, everyone.
Thank you.
Nice to meet everybody.
Yes, lovely to meet you.
All right.
Likewise.
Stay
Thank you.
safe.
Good luck, Nada.
Thank you.
Bye. Bye.